I'm Ronnie Barnes, Vice President and Head Athletic Trainer for the New York Giants. With over 30 years of experience in the National Football League, I've seen a large number of outstanding athletes perform on the athletic field, whether they play for 1 day, 4 years, or 12 years. One thing is for certain, the athlete will stop playing football and transition to life after football. While this transition involves many life changes, the retired player health status is important. Their aging process evolves as it does for similar age people in the general public. In order to assist the retired NFL players in their health after football, the National Football League Players Association and the NFL have formed an alliance to support the health needs of these players. Included in this process is a national cardiovascular education and health screening program. Cardiovascular disease is the nation's #1 killer. Unfortunately, it is a silent killer, which makes it hard to anticipate and predict its occurrence with any certainty. Nevertheless, the Alliance for Cardiovascular Screening Program is a major step forward in an organized effort to decrease the occurrence of heart attack and stroke.
Branded multimedia education.
You do need to understand some of the details of the operation.
A powerful tool enhancing the quality of care for patients and their families.
If you're thinking of having your knee replaced, we first need to talk about how the knee joint works.
Emerging as the standard for complete customized patient education.
Improving patient compliance and clinical outcomes.
I was well informed about my treatment before it started, and this made the experience much more tolerable.
The American Medical Association's highest award.
I had high blood pressure and a borderline cholesterol problem, 2 risk factors for coronary disease. For me, the treatment was changing my lifestyle and medication. I was relieved to learn I could do something myself to lessen my chances for heart trouble. It's a lifelong commitment. Today, my blood pressure is under control, my cholesterol levels are healthy, and they're going to stay that way. I've become a partner with my doctor in the future of my health and well-being.
All of us here at your healthcare facility, doctors, nurses, technicians, and cardiac rehabilitation specialists, want to provide the best possible care and assistance in your disease treatment. Of course, you're the most important member of the team. Much of the success of your treatment and long-term recovery depends on you.
Let's look at a healthy heart. Your heart is located under the rib cage, to the left of the breastbone, or sternum, between your lungs. The heart is an amazing organ. Shaped like an upside-down pear, this fist-sized powerhouse pumps 5 or 6 quarts of blood each minute to all parts of your body. The walls of your heart are made of muscle, which contracts to pump blood into the arteries. The heart is a 4-chambered hollow organ. It is divided into a left and right side by a muscular wall called the septum. The right and left sides of the heart are further divided into 2 atria, top chambers that receive blood from the veins, and 2 ventricles, bottom chambers that pump blood into the arteries. The left ventricle is the major pumping chamber of the heart. Its contraction provides enough force to pump blood from your head to your toes. Atria and ventricles work together, contracting and relaxing to pump blood out of the heart.
I'm Alan Levy, known around the league as Doc. I've spent a great deal of my professional years caring for NFL players. We have traveled to NFL cities around the country to help the NFL retired players reduce their risk of being harmed by heart attack, stroke, and other diseases. We have emphasized prevention, early diagnosis, and prompt management of cardiovascular risk factors. In this process, our core volunteer screening team works in partnership with outstanding regional hospitals and physicians to deliver a community health program in NFL cities around the country. This cardiovascular health initiative has been well received by the NFL retired players. It has been gratifying to interact with the former players, many of whom I remember fondly from their playing days. It seems that our CV screening program is part of a continuum that begins with the NFL Combine, pre-participation physicals, exit interviews, and finally post-football retirement, education, testing, referral, and early intervention for health problems. I'm proud to be a part of the new NFLPA-NFL Alliance. This effort shows the real concern for these athletes as they continue their lives as regular citizens following the active gridiron years.